Hello, everyone, and welcome to the Summit of Strength webinar series. This is Jessica from SMA's Family Support Department, and we thank you all so much for joining for today's presentation, Understanding the Role of Social Work. We are so thankful for our national presenting sponsors, Biogen and Genentech, as well as platinum sponsors, Accredo, and supporting sponsor, Scholar Rock, for their generous support of the 2021 Summit of Strength webinar series. We really appreciate all the questions that we've received in advance of today's presentation, and we'll try to answer as many of these as we can during the webinar. You are able to submit questions throughout the webinar using the questions box, and you can find that located on your GoToWebinar toolbar. Also, be sure to stay until the end of the webinar to participate and have your questions answered in the Q&A session. I did want to note that all lines will remain muted during the webinar other than for the speakers. And if you have any additional questions after the presentation, please contact the SMA Family Support Team at familysupport@curesma.org. We'll be starting today's summit with a presentation from Robin Golick, who is representing Genentech, and she will be sharing a brief introduction of ebrizd. Welcome, Robin.
How about now? Now I'm not muted. Hi, good afternoon. Thanks for the introduction. I am so excited to be a part of this Summit of Strength and to be able to represent Genentech today as we go over some information about ebrizd. So ebrizd has been proven to make a difference in infants, children, and adults with SMA in people 2 months and older who have a broad range of symptoms and motor function. Next slide, please. So again, my name is Robin Golick. I'm a registered nurse, and I'm a partnership and access liaison in South Florida. And so the picture here that you're looking at is a group of pals across the country. And I guarantee you that one of these is in your area. We have someone dedicated to all areas in the United States. And we are dedicated to the community. We are able to support you, your family, your caregivers through your treatment journey. We are the main point of contact in the local area. And if you're interested in how to contact your PAL, we'll go over that a little bit later in the presentation. So as a PAL, I mentioned that we are the local point of contact, and we work with a team of My SMA Support. Even though many of us are healthcare clinicians, like I said, I'm a registered nurse, we're not able to have, or we're not going to be giving out medical advice, as this is a conversation that you should always have with your physician. And again, we'll go over how to contact a PAL or connect with someone a little bit later. So in the interest of limited time that we have today, let's look over a few of the topics that we're going to cover today. Next slide, please. So we're going to talk about ebrizd and how does it work. We're going to look at the clinical trials and some of the results that came of those trials. I'm going to talk to you about how to take ebrizd, and we're going to look at the actual support services that Genentech offers. And as with any medication, when you're looking into a new medication, safety is paramount. So let's start with some important safety information. Next slide, please. So what is ebrizd? Ebrizd is a prescription medicine that is used to treat spinal muscle atrophy, or SMA, in adults and children 2 months of age and older. It is not known if ebrizd is safe and effective in children under 2 months of age. So before taking ebrizd, it's really important that you talk to your doctor if you have any liver problems, are pregnant, or if you plan to become pregnant, or breastfeeding, or plan to breastfeed. Ebrizd may harm an unborn or breastfed baby, and ebrizd may also affect a man's ability to have children. So these are conversations to have with your physician. Also, tell your doctor all about the medications that you take. As we go into this presentation, we're going to mention some of the safety information, but these are not all the possible side effects of ebrizd. And again, you can listen out throughout the presentation. These will be listed, and you also can look at these through the full prescribing information or the package insert. So as I'm sure that most of you are aware, SMA symptoms are caused by insufficient amounts of functioning SMN protein. And these are throughout the body. This protein is just an essential protein to neuromuscular growth and development. Next slide, please. So how does ebrizd work? Ebrizd is designed to work by helping to make and maintain more SMN protein. And in animal studies, ebrizd was distributed throughout the body. And in fact, in the clinical trials, within 4 weeks of starting ebrizd, the median SMN protein levels more than doubled and were maintained for 12 months across studies, across all SMA types. So let's look at who was included in this trial program. Next slide, please. So ebrizd trial program was designed to be inclusive of a broad range of people with SMA. And as you can see here today, more than 450 people have been included in the trials with type 1, type 2, and type 3 SMA. They've ranged in ages from 2 months to 60 years of age, and they've had a various degrees of severity and motor function ability. And I do want to note that efficacy was only studied in people from 2 months to 25 years of age. So let's look at some specific trial information on the next couple of slides. Next slide, please. So ebrizd received FDA approval based on results from the first 12 months of 2 studies. And these 2 studies, and these are 2 ongoing studies, these 2 studies were Firefish on the left and Sunfish to the right. Firefish, and there's a lot going on this slide. There's a lot of information, but I really just want to give you just a summary. We only have a brief amount of time. I really want to just kind of summarize it for you. So Firefish was for infants with type 1 SMA. These were babies that were 2 months of age up to 7 months of age. Sunfish was for children and adults with type 2 or type 3 SMA, and these were ages 2 years to 25 years of age. Now, in both of these studies, there was a dosing study, kind of looking at the best recommended dosing, as well as efficacy and safety. A third supportive study, or Jewelfish, is currently ongoing, and it's looking at the safety of ebrizd for people with type 1, 2, or 3 SMA who have been previously treated for other SMA medications. So let's review the next slide for some results. So as a reminder, this first study, Firefish, was for type 1. These were babies that were 2 months to 7 months. And ebrizd helped these infants with type 1 SMA achieve a key motor milestone. And that is that 41% of the infants in the trial were able to sit for at least 5 seconds without support. Now, I want to remind you that untreated infants with type 1 SMA are usually not expected to sit without support. Another assessment that was relative to the need for permanent breathing support. So let's go to the next slide. So ebrizd has helped infants survive without permanent breathing support as well. In 12 months, at the 12-month mark in the study, 90% of these babies were alive and could breathe without permanent support. And then looking out a little longer, at 23 months, 81% were alive and could breathe without permanent support. So let's switch gears now and look at this older population of the 2 years to age 25 years of age. Next slide, please. And this is the Sunfish trial, type 2 and type 3 SMA. And here, children and adults treated with ebrizd showed improved motor function versus those not taking ebrizd. And this motor function was actually measured over about 12 months. And it was done so using a scale or a testing means called a motor function measure, MFM32. And essentially, this is 32 unique items. And these are different elements that actually measure motor function or motor abilities that involve the trunk, the upper body, and upper limbs. And if you look at this, let me orient you to this slide. If you're looking from left to right on the graph, it goes from 0 months, which is at the beginning of the trial, all the way to 12 months. And the blue line indicates those patients who were on ebrizd, and the gray line indicates the patients who were on placebo or an inactive ingredient. So therefore, they weren't on ebrizd. And if you look at those 2 lines at the bottom or at the end there where it says 12 months, you can see that there is a difference in the blue line to the gray line. And that difference ended up being an average score increase in those who were on ebrizd of 1.36 points versus those that were not on ebrizd, they actually decreased 0.19 points. We also learned some important safety information in these trials. So let's go to the next slide. So ebrizd is being ongoing studied right now in a broad population from 2 months to 60 years old in type 1, 2, and 3 SMA. In the trial so far, we've learned that the most common side effects of ebrizd is similar in both the infants or the babies, as well as for the children and adults for type 2 or 3 SMA. And that really is about the side effect, most common side effects are fever, diarrhea, and rash. Additionally, in the type 1 or the younger children, this was also seen constipation, vomiting, lung infection, as well as symptoms indicative of an upper respiratory infection, such as runny nose, sneezing, sore throat, and cough. So these were just some additional side effects. These aren't all of the potential side effects of ebrizd, and if this is something that you want to look at and compare like a risk and benefit profile, make sure that you talk to your healthcare provider about all the risk. I think it is important to note that no one in the clinical trial actually stopped the medication or dropped out of the main clinical trial because of a side effect. Next slide, please. So let's switch gears and start talking about some basic information about ebrizd and how you would receive it. Ebrizd is the first and only medication to treat SMA with at-home dosing. It's a liquid. It's taken by mouth or feeding tube. Your physician will actually determine what the dose is based on age and weight, and then you will want to make sure that you take the dose that's specific to you. This dose will then be delivered to your home. You'll store it in your refrigerator, and either you or if you have a caregiver can actually give yourself that medication with the syringes that are provided. And again, it's taken once a day by mouth or feeding tube, and we do recommend taking it about the same time every day after a meal. So we have a host of resources to help you through this process. And let's go to the next slide so I can kind of talk about my SMA support. So Genentech, my SMA Support is a Genentech service, a support service. And the PAL role actually falls into my SMA Support. And there's a whole team of people working behind the scenes to make my SMA Support work for you. And so through my SMA Support, the PALs and the team behind the scenes can provide product education, insurance and financial assistance, coordinate the specialty pharmacy for delivery, as well as provide additional support. And again, I do want to remind you that we won't be able to provide medical advice to you, and we're always going to ask you to take those kinds of questions back to your provider. So I've gone over a lot of information today, and I want to review just some key points with you. Next slide, please. So ebrizd has been proven to make a difference in infants. It's been proven to make a difference in children, and it's been proven to make a difference in adults with SMA. This evidence came from 2 main studies that we've gone over the evidence already. We've gone over the results. We've shown that ebrizd increased and maintained SMN protein levels in the clinical trials. We have ongoing safety studies from age 2 months to 60 years in types 1, 2, and 3 SMA. And finally, ebrizd is the first and only at-home treatment for SMA that will be delivered right to your doorstep. So if you have any more information or you want to talk to your healthcare provider about ebrizd and see if ebrizd could be right for you. If you want some more information or if you'd like to connect with a PAL, you can go to www.ebrizd.com and you can either go to sign up or find a PAL. Next slide, please. And that concludes the presentation. I just want to thank Cure SMA for allowing me to be here and to provide some information. So with that, I'll turn it back over to Sarah.
Well, thank you so much, Robin. We really appreciate it. Hi, everyone. This is Colleen McCarthy O'Toole with the Cure SMA Family Support Department. We'd now like to welcome today's presenter, Danny Sun, who will be sharing her presentation, Understanding the Role of Social Work. Danny's an SMA mother, holds a master's degree in social work, and is the social work manager with the Cure SMA Family Support.
Thank you, Colleen. Good afternoon to everyone listening. Thank you so much for tuning in today and taking the time for this. So before we get started, I wanted to share a little bit about my background so that you know where I'm coming from with my experience. I have been practicing social work for about 15 years. Prior to joining Cure SMA, I worked in the county I live here in Wisconsin in a variety of roles, but all of them supporting children, adults, and families impacted by mental illness, addiction, or just other life challenges that we all face. I helped refer individuals to supportive services like counseling and medical care, and also worked one-on-one with people to help them identify their goals and what obstacles existed that were getting in the way of accomplishing their goals. So as Colleen mentioned, I also have two children who are both in elementary school and are living with SMA. They, when they were both diagnosed in 2013, our day-to-day routines and priorities shifted, of course, and I immediately began to feel grateful for my professional experience and how it supported our need to navigate or advocate for their care and navigate a complex healthcare system and connect them to the services that they needed. And then I also very quickly realized that there was an enormous focus on physical health needs of those facing an illness like SMA, as there should be, but there was much less focus on supporting the emotional and mental health of those living with SMA and other rare disorders. A lot of that support was more informal, so between peers, between families, but not as much formal at clinic appointments or with our medical team. So it got me thinking about how the emotional well-being is just, our mental health is just as important as our physical health. Someone can be in perfect physical health, but if their mind is overwhelmed with feelings of worry or loss or heartache, there will be suffering. And so one of my passions since our family was introduced to SMA is to be of service and support to others in the rare disease space as a whole, but especially within our community, by raising awareness for the need for better support for social, emotional well-being of everyone. And social workers should have a direct positive impact on alleviating these challenges. And it is my hope today that you will leave with a better understanding of the role of social workers and how social workers may be of support to you and or your family. So today we will discuss what social work is and the focus of the profession, also how social workers help in communities, and then more specifically, how might a social worker help you and support you in your specific situation. Next slide, please. Thank you. Okay, so this is one of my favorite images to describe the profession of social work because it's such a clear, accurate description. Very often the role of social workers is linked to, or people think of child protective services and specifically a role within their role within abuse or neglect cases, because that's what we see in the media or on a television series or movie. But social work is really about so much more than that. And at its core, everything we do to support and empower, or everything we do is to support and empower those around us to live fulfilling lives. So we focus on helping people find what their underlying needs are, which are those needs that are not met and that are resulting in creating challenges. And then we try to get creative in how to address those unmet needs. I really like the description that I once read about social work being an art and a science. It's an art because social work requires great skill in understanding people and empowering others, but then a science because social workers must use problem-solving skills and be very objective in gathering facts that are contributing to problems that are turning up in the lives of the people that we're working with. And we as social workers are trained to see the individual or the invisible connections between individuals, families, communities, society, and laws and policies that govern all of that. And when those connections get tangled or there's a breakdown, we're trained in how to address those and make changes to help everyone. So this notion of empowerment is central to social work. We often say that we exist to work ourselves out of a job. So our goal is to empower others, individuals, families, communities, to be able to identify their needs and then better themselves. There's a caveat, of course, individuals that have ongoing challenges, such as someone living with a disability, will be provided with support, as much support as they need, as long as they need it. But the goal is to create an environment that allows for as much independence as possible. Next slide, please. Okay, so I cannot give a presentation on the social work profession without sharing this quote by Brene Brown. She's sort of a social worker superstar in the social work profession. She holds a PhD in social work, focusing her research on courage, vulnerability, shame, and empathy. And this quote really drills down to the core of what social workers do, no matter what role you find them in. It says, social work is all about leaning into the discomfort of ambiguity and uncertainty and holding open an empathic space so people can find their own way. In a word, messy. So if you're listening now, you're likely familiar with SMA and all that ambiguity and uncertainty that it holds. Whether you're newly diagnosed or have been living with SMA for many years, the unknown of how to prepare and respond to changes and challenges in life are often the most difficult aspects of the disease. A skilled social worker will not only direct you or directly connect you to tangible resources, but they'll also provide you with a soft landing and a safe space to navigate the emotional side of SMA so that you can move forward with more confidence. They'll have those conversations that are hard to have and uncomfortable but necessary. Next slide, please. So this description references the Social Work Code of Ethics, which is established by the National Association of Social Workers. What I want to highlight here is that social workers are ethically bound to advocate for equal access to healthcare and to advocate for changing systems that are repressing individuals, including those with disabilities. So the values of social work fall into three categories: professional integrity, human rights, and social justice. So professional integrity includes upholding values of being trustworthy, having professional boundaries, using sound judgment, and being accountable for our actions. Human rights includes treating everyone with dignity, respect, encouraging self-determination, having a holistic view of an individual, and developing strengths in those that we serve. Social justice includes challenging discrimination, recognizing diversity, equal distribution of resources, and ensuring everyone is provided equal resources, challenging unjust practices and policies, and practicing inclusivity. So as you can see, all of these values are ones that seek to support individuals living with a disability like SMA and really serve to benefit and better the lives of individuals with SMA. So you should expect any social worker that you come in contact with to exemplify these values. And if they don't, it's okay to respectfully address it and to advocate for the care and for the treatment that you or your family member should be receiving. And social workers should be held to a high standard of care, as we would for any other professional in a healthcare role. Next slide, please. So I mentioned previously that social workers exist in many roles and programs. So to give you an idea of the wide variety of organizations and entities where you may work with someone trained in social work, I put together this table. It's by no means exhaustive, but are some of the more common roles. The majority of social workers do work in mental health, child and family services, education, and healthcare. And actually a large majority of the mental health services provided in the US are actually provided by social workers, not by psychiatrists or psychologists like some may think. But I really wanted to highlight that all social workers are uniquely trained based on their field of work, including ongoing professional development. Some social workers are licensed to provide clinical services and treatment as well. So this would include obtaining a master's degree plus clinically supervised field hours by someone else who's licensed, and then completion of a state licensing exam. These social workers are then licensed to diagnose mental illness and provide therapeutic intervention in a counseling session. So if you were to face anxiety, depression, or any other mental health symptom that was causing you problems in your day-to-day life, you may begin seeing a therapist, and that person is often a licensed clinical social worker. So they're a little bit different than someone who has a bachelor's in social work or is a case manager, as you might hear them referred to. They have that additional training and expertise. So as you can see here, you may interact with social workers in a variety of places and in a variety of ways over your lifespan, not just in relation to SMA. I think most of us at some point in time or another throughout our lives will interact with a social worker who is there to provide support. Next slide, please. So before we look at the social work role specifically in relation to SMA, I also wanted to highlight the strength-based perspective, which is a social work practice theory that emphasizes individuals' self-determination and strengths. It's also utilized now in other professions like nursing and in education. So you can see here that it's about analyzing what strengths we have and building on those strengths, not focusing on the deficits or what we're missing. So anyone who faces adversity knows that it takes a good amount of grit, perseverance, and resiliency to overcome challenges that are consistent and that you're facing day in and day out. And the strengths-based perspective is not about ignoring problems, but it's also not fixating on them. It's about identifying what's working when things are going well, and then working to build on those strengths and positive aspects when things are not going so well. And it also draws the individual, the family, into the process, gives them ownership, and empowers them to take control over it. So we all have strengths that we overlook and forget about when we're feeling especially stressed out or in a high stress situation. And it's the job of social workers to ensure that people that seek help for the problems that they're facing are not reduced to those problems, but instead are viewed as persistent, perseverant, resilient, and creative, because as humans, we are most likely to make positive change when we are encouraged, not criticized. And a skilled social worker should be taking a strengths-based perspective in helping you to overcome those challenges, and you can expect them to do so in the time that they're working with you. Next slide, please. Okay, so many of you will interact or already have with social workers during visits to a multidisciplinary neuromuscular clinic, and you will likely interact, or you may interact with a social worker in the community as well. If you receive a diagnosis in a hospital or are hospitalized, you may, be referred to meet with a social worker, but it will likely be, if the hospital has a clinic attached to it, it will likely be the clinic social worker who will come to meet with you because they have that expertise. But every person needs a social worker on their team. If you haven't met with one through your clinic or medical team, you can inquire about it, absolutely. I've found that the social work role is sometimes underutilized because many people might just not be aware of the support and the specialized training that social workers have. And so they might not sometimes ask to be connected if their team doesn't automatically provide them with that service. And it's also hard for some people to ask for help and share vulnerabilities, which is understandable. But I can't stress how beneficial seeking help from that kind of support can be, because as you can see, they can help with a wide variety of needs that those with SMA have on a day-to-day basis. So social workers can provide direction on how to apply for a Medicaid waiver, Medicare, any other entitlement program that is run by your state. They can also connect you with local resources, such as nonprofit organizations. These can include things like a equipment closet where you can borrow medical equipment from at no cost, or accessible day or overnight recreational camps, or accessible recreational opportunities like adaptive sports. So those are just some examples of things they should be able to provide you that provide you with support and help you build the life that you would like outside of your medical needs. They can also help you find local and online resources for support groups if that's something that you are seeking. And I know a lot of people will work with a social worker when it comes to financial challenges, so they can discuss those with you that you may have in terms of medical costs and help to refer you to programs that can help address those challenges or plan for future costs that you anticipate may be coming. They can also help families, couples, and individuals identify stressors that they're facing, and talk them through and come up with some coping skills or strategies that you can implement in your home. It's just so important that someone on your team is checking in with you regularly about how you and your family are feeling. A mental health checkup should just be as routine as a physical health checkup, and social workers should be doing that with the people they're working with. Talking about those stressors between you and your partner, between siblings, stress resulting from caregiver issues, etc., is so important. Not every problem, of course, can be solved immediately, but they should be talked through. You never know what kind of support or resources might be available. And just having someone to voice those frustrations to can be really helpful. You don't have to power through and deal with constant feelings of stress or feeling overwhelmed. A social worker should be able to provide that emotional support that we all need, and then help you to find the resources to address some of those challenges. And if you do need support of a professional counselor, then the hospital or clinic social worker can make a referral or help you find a counselor through your insurance that can provide individual, family, or couples therapy, depending on what your needs are. And then they can also help you navigate special education or employment accommodations. So they could help discuss with you what challenges you're facing and who is the best person to connect with, either at school or at work. So they won't solve the problem themselves, but they can help you brainstorm and figure out who's the best person for you to connect with so that they can assist you further. And then they can also advise you on when to seek out professional advocacy services, like through a disability rights center or something similar, if your legally protected rights are being violated. Next slide, please. So not to muddy the waters at all, but when I had originally put together this presentation, I had the roles and responsibilities between a social worker that may work in a hospital and then a social worker who's connected to a clinic, separate, but really who completes these tasks will depend on your specific hospital or clinic or where you're getting services from. But that said, these are duties that a social worker in a hospital may complete or may be done by a clinic social worker who would visit you during an inpatient stay. If you're receiving a diagnosis while inpatient, a social worker can help to help a family or an individual understand the impact of the diagnosis, particularly the emotional challenges that can be expected, and then programs that you can apply for right away. Social workers within the hospital setting can also be an integral part in helping the larger medical team understand how a diagnosis is impacting a family or an individual. They can also, and this is a primary role of social work, be an advocate for you, with you, on behalf of you, however you to determine the level of support you need to ensure that your needs are, or your desires and needs are being heard, and that your needs are being met during difficult times like an inpatient stay. And then discharge planning may be done by a specific social worker in the hospital. Sometimes they're referred to as case managers, or discharge planners. So while your specific hospital or clinic may employ these roles differently or have a different person carry out the role, it will be by a social worker, and you should be provided these services one way or another. Next slide, please. So many of you may have a social worker, sometimes referred to as a case manager, who is assigned to you as part of your enrollment in any entitlement program like Medicaid or Medicaid waiver program. These social workers are assigned specifically to these programs, often through the county that you are living in, and they are tasked with supporting you because you're enrolled in that program. Generally, this will include face-to-face meetings at regular intervals, and they have to see you face-to-face, often in your home, or if you choose, you could go into their office. But because they are responsible for creating kind of a plan of care, which documents the services that may be funded through the program that you are in, they have to see you face-to-face to be able to work with you and continue to assess your eligibility for the program. If the program is providing alternate therapies like equine therapy or art or music therapy, the frequency and the detail of those services should be very clearly outlined in your plan so that you understand what services you're being provided and they understand how they are supposed to go about referring or helping you to get connected. It should be very clear to both of you. Additionally, if this program is providing respite hours or funding for home modifications or vehicle conversions, that should also be in the plan. So it's all tying together, and they are justifying why you need these services so that they can be provided through the program. So that's a crucial part of that case management role in a social worker in those community programs. They'll also be responsible for renewal of your eligibility in the program, so that typically entails an annual reevaluation where you'll go over your eligibility for the program and continue your enrollment. So one thing I definitely want to touch on is that it's important to understand, although I'm sure many of you have faced this, I know we have, that there are many rules and policies surrounding state-run entitlement programs. This is often one of the challenges for social workers, is just the amount of paperwork and policy guidelines that have to be followed so closely. And this entails retaining a lot of detail that can change often, which can be confusing as you're trying to implement these policies, and which definitely vary by state and can even vary down to the county in which you live in. So it's really helpful to work closely with your social worker and to ask all the questions you need in order to feel you understand the benefits and the responsibilities of being enrolled in the program. Sometimes eligibility or processes change so quickly that your case manager or social worker might not even know of the change before you do. I know in our experience, we'll often hear about policy changes or resources that are available by word of mouth, because peers and families talk so quickly to each other and share resources, which is fantastic. But it can be frustrating if you hear about it first from appear before even your social worker that is supposed to have these resources. So expect that there will be challenges along the way, and just remember that advocating for yourself or your family is always okay. And in my experience, social workers have your best interest at heart, and will make mistakes, and it's really a partnership to be able to get the most out of the programs that you are enrolled in. Above all, partnering with a social worker should be a positive experience. It should be one that results in alleviating some stress from your life, and helping you feel more confident in coping with whatever the future brings. You can and should expect to be provided non-judgmental support, expertise in resources and the referral process to those resources, and to be connected with someone who can creatively problem solve with you solutions to day-to-day challenges, and just really get creative. In the time that I have been a social worker, I have had to get creative in helping others very often. I remember one time I worked with someone who was recovering from surgery, and for the first time in their life, they were using a walker for support, and she just did not feel comfortable taking the bus with it. So for a few weeks, my visits with her consisted of riding the bus to and from the grocery store and practicing what's the easiest way to get on the bus, where is she going to keep her walker while she's sitting, and just this repetitive practice really helped her. So by the end, she was doing it on her own, and I was there to support and encourage, but she was just feeling supported and able to become more independent again. I remember another time I was working with someone who was struggling with the number of appointments that they had and the medications that they needed to take and keeping them straight. So for a month or so, we met every Monday and we went through all their appointments and all of their medications, and we figured out what was the best organizational system for them, with calendars or lists or whatever that might be. And by the end, they were taking over all of the things that they were working on, and they felt more comfortable with it, knowing that they had some support and some encouragement. And even with my own children, I often utilize my social work training. They will tell you that when we have appointments, we always talk ahead of time, and we if there's an appointment coming up that might be stressful or they're worried about, preparing for that, talking about the questions that you might have, writing them down. A social worker can help you prepare for an appointment or a procedure that maybe you're feeling apprehensive about, so that you feel more equipped and empowered and confident in interacting with your medical team and ensuring that you're feeling heard. So I just wanted to share these examples because I want everyone to know that if they're feeling like they're lacking the support, if you're feeling like you're lacking the support in managing day-to-day challenges that arise, that there are resources available to you, and that is a social worker. So please don't hesitate to reach out to your medical team and inquire about being connected to those kinds of supports that I have outlined here today. So thank you again for your time. I hope that it was useful for you, and I will pass it back now to Colleen.
Thank you so much, Danny. That was such a great presentation. The first question that we received today was, what role does social work play in helping patients access currently available treatments and future treatments?
That's a great question. So social workers that are within a medical setting can advocate with you to your medical team to be able to access a treatment. So if you are working with a medical team and you feel like you're not being heard on which treatments that you're wanting to explore and learn more about, the social worker on your team can absolutely advocate with you to explore that further. And then we didn't get into it today. I didn't get into this role today, but many social workers work on a macro level, meaning that they work in roles that focus on changing large-scale social systems and issues that affect individuals negatively across society, such as healthcare inequities accessing necessary treatment, which would be one of those things. So these are leaders within those systems that advocate for changes. So not necessarily somebody that you're going to work with day to day, but there are social workers who focus on those sort of inequities within healthcare.
That's great. Thank you so much, Danny. The next question we received was, can a social worker help emotionally and practically prepare for unexpected health crisis and possibly even the death of a loved one?
Yes, absolutely. So the social worker that you may work with day to day or in the clinic, these are conversations that you will have and that you should have and feel comfortable bringing up to them. Ongoing, and I'll just say I recommend everyone works with a therapist at some point in their life, especially people who are living with SMA or any kind of disability. There are bumps along the way and stressors that you can't get rid of, and you have to find some way to manage those and live the fulfilling life you want to. So I encourage everyone to meet with a therapist, just like they meet with a doctor. But specifically, this kind of support would be best implemented by a therapist, so by a licensed clinical social worker or someone who's qualified to provide mental health therapy. Having that unbiased person just to be able to voice your fears to, who can just listen to you without agenda, and who can give you sound advice is very helpful. And there are clinicians, licensed social workers who specialize in grief or planning for grief or living with a disability, so you can seek out those services. But not every social worker is licensed and therefore qualified to provide that kind of ongoing clinical care. So a social worker that you work with in the hospital or in a community might refer you out to a licensed clinical social worker for ongoing therapeutic support.
That's great, thank you. The next one I know is a common question we often receive at Cure SMA about transitions. The question is, can a social worker help an adult with SMA transition to living away from home?
Yes. So where you access this support may differ depending on your situation. The first thing I would, if you're working with a clinical team, I would approach them about it, and hopefully they will have a social worker through the hospital or on staff through the clinic that can help you start to explore the things that you need to look into to get everything lined up, finances, living expenses, where you'll live, things like that. You could also contact your local disability resource center. Every state has one. They might go by a little different name, but if you just Google Disability Resource Center in your state or your county, you should find resources there. Those are staffed by social workers who help adults or anyone living with any kind of disability figure out what services are available to them, any resources, and just get them connected with how they can plan ahead for that. So yes, you can definitely get help. Transition planning is a big part of the social work role. We just want to get you connected to the right social worker, depending on your situation.
Great, thank you. We have two questions left that we're going to ask today. The next one is, how can I spread information and awareness about all of these resources that you've talked about today?
Well, I love hearing that. So definitely this will be recorded so people can share this out, which will be a great way to spread the information here. Also, some ways, not necessarily the specific presentation I gave today, but I make sure that I am following like my state Disability Services Department, our Department of Health and Human Services, and any other like social service agency in my community that has a social media platform, because they share a ton of information, training, resources for all ages, children, adults, parents. And so that's a really great way to access resources and then make sure you can share them with other people. Another resource that you can follow is Vital Voices. So if you're a family who has a child with a disability. Vital Voices is a great resource. It's a national organization that has organizations in each state, and so they can help with training and a lot of school support help if you're living with a disability and have special education services. And then also, of course, if you haven't connected with your medical team and been connected with a social worker, make sure you do that so that you can share out those resources with others.
Great. And one last question, it's an interesting one. I don't know the answer to this one either, is how can I become a social worker?
Oh, I love this question. We need more social workers. So you can get a bachelor's degree in social work, which will equip you to work in case management level positions, such as with children and families or other youth and adult programs. There are a wide variety of positions that only require a bachelor's degree. And many of these positions also even accept a related field of education like psychology or sociology or even criminal justice, because many human services workers work in that field and help people reintegrate into the community after being incarcerated. So there's, depending on your interests, you can get a bachelor's degree and then apply for various social work positions. And then, like we spoke today, you can also go on to get your master's to do more clinically focused work or really individualized work like school social work, medical social work, or providing therapy or treatment.
Wonderful. Thank you so much, Danny. And thank you to all of our fantastic speakers today. We really appreciate it, and I think we all learned so much. Hi, everyone. My name is Sarah. I am a manager with SMA's Family Support Department. And I also wanted to just thank everyone for joining on the webinar. So as usual, if you've attended many of our webinars, you know you'll be receiving a follow-up email, which will have a survey link, and we would really appreciate any feedback that you have to share. We also welcome you to visit our website to register for upcoming Summits of Strength as well. We have one coming up in March, on March 10th. That will be pain management, other modalities to manage pain. We did have a pain management presentation last fall, and we will be getting some updated and new information to share then. So be sure to register and keep an eye out for other Summits of Strength this spring and summer. And again, if there's anything that we can do for you, or if you have any additional questions, please email us at familysupport@curesma.org. And finally, I have to give a big thank you for the incredible support from our sponsors for making this Summit of Strength webinar series possible. Have a fantastic day, everyone.